Have you ever felt like you're doing everything right, tending all your doctor's appointments, getting every checkup on time, following orders like clockwork, and yet something inside you feels off? You're not alone. Seniors across America are walking into clinics believing they're protecting their health only to walk out feeling worse, more anxious, more medicated, and more confused than ever. What if I told you not all health checkups are helpful after a certain age? In fact, some can cause real harm, both physically and emotionally. Today, we're going to uncover 5 health checkups that adults over 70 may want to think twice about. Some could lead to unnecessary treatments, while others may steal your peace of mind. And the final checkup, the 5th, one needs the most shocking of all. So stick with me, because this just might change how you care for your health in your golden years. Imagine this. You're 72 years old, still sharp, active, and enjoying your retirement. You go in for a routine screening test, something you've done for decades. But this time, the doctor finds something abnormal. Panic sets in. You go through follow-up scans, biopsies, more tests, and suddenly you're scheduled for a treatment you don't even understand. Weeks later, you feel exhausted, in pain, and your daily joy has vanished. What went wrong? Here's the truth: some screenings catch things that never would have hurt you. They just scare you. And when you're over 70, the risks of treatments can be greater than the problem itself. Let's talk about the first test on our list: routine prostate cancer screening for men. Now, this may sound surprising. Isn't it good to catch cancer early? Yes, in some cases. But prostate cancer is unique. Many forms grow so slowly that they never cause harm, especially in men over 70. But once you re-diagnosed, it's hard not to panic. And the treatment, surgery, radiation, hormone therapy can have serious side effects like incontinence or sexual dysfunction. The emotional toll, devastating. You might have gone from a vibrant life to one filled with hospital visits, weakness, and regret. Studies now show that routine PSA screening in older men often leads to overdiagnosis and overtreatment. For some men, that abnormal result may never have affected them at all. Before agreeing to a prostate test after 70, talk honestly with your doctor. Ask, how will this result change my life? Because sometimes, knowing less really is living more. Second checkup to think twice about is colon cancer screening after 75. Yes, colonoscopies save lives. But after 75, the math changes. The risks of the test itself, such as bleeding, perforation of the colon, or reactions to anesthesia, go up. And if a small polyp is found, you may be sent for more invasive procedures that can be hard to recover from. Here's something few people tell seniors: your life expectancy. Overall health and quality of life matter more than the polyp. Many seniors pass away with small growths in their colon that never caused harm. But aggressive treatment can lead to complications that shorten your life or steal your peace. And the worst part, no one talks about how traumatic it feels to go through the prep for a colonoscopy alone, vulnerable, sick from laxatives, scared of the unknown. If you're in good health and really want it, fine. But if you're frail, have heart issues, or are already struggling, pause. Talk with a geriatric specialist. Don't let fear push you into a procedure your body can't handle. Now, let's talk about something that affects millions of women: over 70 mammograms for breast cancer screening. We've been taught since we were young women that annual mammograms are a must, but after 70, it's not so clear. While early detection has its place, mammograms after 70 often find slow-growing tumors that wouldn't have caused problems in your lifetime. But once they're found, treatment becomes almost inevitable. And for many older women, the surgery, chemotherapy, and radiation that follow can be physically and emotionally brutal. Not to mention the false alarms. Imagine getting a call saying something looks suspicious. Do you wait for days, maybe weeks, in terror? Then it turns out to be nothing. That emotional roller coaster steals your sleep, your appetite, your joy. The U.S. Preventive Services Task Force doesn't recommend routine mammograms after age 74 for average-risk women. The key here: personalization. If you're healthy and want to screen, fine, but don't be pushed into it just because it's routine. You're allowed to say no. Checkup number 4 may come as a shock. Routine whole-body scans or advanced imaging just to check. In recent years, more seniors are being offered full-body MR, IS, or CT scans by private clinics. They promise to catch everything early, but the truth is far more complicated. These scans often reveal small, harmless abnormalities called incidentalomas. And once they're found, doctors feel obligated to investigate further. That can mean biopsies, surgeries, or even cancer treatments for things that might never have harmed you. Meanwhile, the radiation from certain scans increases your risk for future cancers. Ironic, isn't it? Seniors like 76-year-old Robert from Ohio have shared horror stories. After one of these preventive scans, doctors found a small spot on his kidney. Within months, he was in surgery. Recovery was brutal. In the end, that spot was benign. Robert said he wished he'd never known. As you age, watchful waiting can be wiser than aggressive intervention. Don't let fear or flashy marketing lure you into unnecessary scans. You are not a science experiment, you're a human being with a life to enjoy. Now, the 5th and final checkup. This one is the most emotional of all. Because it's not a test for your body, it's a test for your mind. I'm talking about routine cognitive screening in people over 70 without symptoms. Yes, dementia and Alzheimer's are real fears. And if you or your family have noticed memory changes, by all means, get evaluated. But when you're feeling mentally sharp, and someone insists on giving you a memory test just because you re-old, that's dangerous. It can lead to misdiagnosis. Did you know that stress, hearing loss, medication side effects, even poor sleep can cause temporary forgetfulness? But once a doctor slaps the label mild cognitive impairment on you, it sticks. It can affect your confidence, how others treat you, even your ability to make legal decisions. Suddenly, your world feels smaller. You stop driving, stop managing your finances, start doubting yourself, and often for no good reason. Many seniors labeled with cognitive decline actually live fully functional lives for years. You deserve to feel respected, not patronized. Before taking a cognitive test, ask yourself, do I have real concerns, or am I just being checked off a list? Your dignity matters more than a diagnosis. So now you know the truth behind 5 common health checkups that may do more harm than good after 70. Prostate exams, colonoscopies, mammograms, whole body scans, memory tests. These aren't bad in themselves, but they must be used wisely, not automatically. You've earned the right to make decisions that are best for you, not just for a chart, statistic, or a system that doesn't know your name. Always ask, how will this test change my life? What are the risks? What are the benefits for me right now? You deserve full answers. And if a doctor can't explain it in a way that makes sense, you have the right to walk away. Let me tell you about Grace. She's 78, lives in Oregon, and volunteers at her church every Sunday. A few years ago, her doctor suggested she stop getting mammograms. Grace was shocked, but after a long talk, she understood why. She felt empowered. She used to dread those yearly appointments. Now she feels free. I've chosen joy, she told me, not fear. Then there's Frank, 81, retired Army vet, sharp as a tack. He skipped the cognitive test his clinic pushed on him. Why? Because I trust my gut, he said. And I still win at chess every week. Seniors like Grace and Frank are not non-compliant. They're informed, brave, and living life on their own terms. The bottom line, after 70, healthcare should be about quality, not quantity. Peace, not panic. Wisdom, not worry. If you're watching this, I want you to know you are not powerless. You are not a number. You are a whole person with history, hopes, and choices. Talk to your doctor. Ask questions. Say no when something doesn't feel right. And always remember, sometimes the most powerful checkup is checking in with yourself. If this video opened your eyes, share it with someone you love. Let's protect our seniors, not just from disease, but from fear, confusion, and unnecessary harm. And if you want more honest, compassionate tips on aging well, hit that subscribe button. Until next time, stay informed, stay empowered, and above all, stay kind to yourself. Because your health is not just about test sits, about trust, peace, and living the life you love.